Imagine you are dying, not in a hospital, not in a clinic, but in a world where no hospitals exist at all. Your body is burning with fever, your vision is fading, and the only doctor you can find is sitting in a marketplace, next to a vegetable seller. Now ask yourself something strange. How did humanity survive for thousands of years like this? No emergency rooms, no trained nurses, no organized healthcare system, and yet something unbelievable happened in the medieval Islamic world. They invented the first real hospitals in history, not just places for treatment, but systems for learning, healing, and saving lives for free. So how did a civilization living over 1,000 years ago create hospitals more advanced than anything before it? And why did the rest of the world take centuries to catch up? This is the forgotten story of how medieval Muslims changed medicine forever.
Imagine you are living in a world where getting sick is not just painful, it is dangerous. There are no hospitals, no emergency rooms, no ambulances, no organized medical system waiting to save you. If you fall sick, you are completely on your own. You lie on a simple wooden bed. Your body is burning with fever. Your head feels heavy, like it is being pressed from the inside. Every breath becomes harder than the last. Outside your room, life continues normally. People are walking in markets. Merchants are selling goods. Children are playing in the streets. But nobody is coming for you. Because in this world, sickness is personal. Survival depends on luck. Now imagine trying to find help. You don't go to a hospital. There is no such place. Instead, you search for a doctor. But doctors are not part of a system. They are scattered individuals. One sits near a marketplace. Another near a mosque courtyard. Another travels from town to town. There are no clinics. No emergency care. No structure. Medicine exists, but it is random. Ancient civilizations like Egypt, Greece, and Rome had doctors. But each doctor worked alone. Each one had different methods, different ideas, different levels of skill. There was no shared system, no standard treatment, no organized healthcare. If you were rich, you might get help. If you were poor, you might get nothing. And if your illness was serious, you were mostly on your own. For thousands of years, this was normal. But there was a problem. Cities were growing. Population was increasing. And disease was spreading faster than ever. A single doctor could no longer handle everything. The old system was breaking. Something new was needed. Not just more doctors, but a system. A place where care could be organized. A place where sick people could be treated properly. Around this time, something important was happening in the Islamic world. Cities like Baghdad, Damascus, and Cairo were becoming large centers of knowledge and population. With growth came responsibility. And scholars began asking a powerful question. What if healing was not random, but organized? What if every person, rich or poor, could receive proper medical care? This idea led to something revolutionary. The creation of the Bimaristan, meaning House of the Sick. But this was not just a building. It was a complete medical system. Inside the Bimaristan, everything was structured. Doctors worked together instead of alone. Patients were separated based on illness. Treatment was organized. Care was continuous. Pharmacists prepared medicines carefully. Nurses helped patients recover. Students learned by observing real cases. This was the beginning of medical teamwork. And most importantly, treatment was free. Rich or poor, everyone was treated equally. Food was provided. Clean water was available. Patients stayed until they recovered. But the Bimaristan was not only about treatment. It was also about knowledge. Hospitals became places of learning. Books were written. Patients were recorded. Diseases were studied. Doctors trained new generations of physicians. Medicine was becoming scientific, not based on guesswork, but observation and experience. Some of the greatest minds of medicine worked in this system. One of them was Al-Razi, who carefully studied diseases and believed in testing treatments through observation. Another was Ibn Sina, who wrote one of the most important medical books in history, used for centuries across the world. Inside these hospitals, medicine became advanced for its time. Patients were carefully diagnosed, symptoms were recorded, treatments were improved over time. Different wards were created for different conditions. Mental health patients were treated separately. Surgical cases were handled with care. Cleanliness was emphasized more than ever before. Visitors from other regions were shocked when they saw these hospitals. They had never seen anything like this level of organization. It was not just a place of healing. It was a system of science, care, and learning combined. And slowly, this idea spread. Medical knowledge traveled across regions. Books were translated. Hospitals in other parts of the world began adopting similar ideas. Centuries later, modern hospitals were built on the same foundation. Today, when you walk into a hospital, you see doctors working in teams. You see nurses caring for patients. You see organized departments. You see structured medical systems. But this did not appear suddenly. It came from centuries of development. And one of the most important early steps was the Bimaristan system. So the next time you see a hospital, remember this. It is not just a building. It is a legacy. A system built from knowledge, compassion, and innovation. And it all began with one simple idea: that every human being deserves medical care.